Before entering the patient's room, we have to wash our hands. To prevent any spread of infection coming from our part. And then we're going to rub our hands. First, we need to verify the doctor's orders. And then now let's proceed to the procedure. So now we have performed hand hygiene and confirmed of this the proper rights, which is the right patient, the right medical procedure, which is two of the most important rights that applies to this procedure. We're going to introduce ourselves to the patient, so we explain the importance and the purposes of this procedure. So this is the urinary bladder catheterization. So this is important for the collection of urine for laboratory procedures, or sir, and it also helps if you are having a difficulty of urinating. So now with that all being said, we're going to gather all the important equipment. So we have the sterile catheter, which is still sterile. We have the sterile gloves, the clean gloves, the drainage, the drape, the lubricant, and then the alcohol for proper hygiene performance. Then we have, after that, we have the important equipment. So now we're going to provide proper adequate lighting, amount of lighting, and then we're going to provide privacy to our patient. So assuming this is a closed door, we're going to close all the curtains and then close the door. Then after providing privacy to the patient, we're going to don our clean gloves. So now we put on our gloves, we're going to prepare the drainage, and then we're going to put the sterile drainage around the patient's perineal area, and then for the female as well, around his labia, I mean the vagina. Then after that, we're going to discard our gloves and then put on sterile gloves. So now we're put on our gloves, we're going to unseal the catheter without touching it at first. So yung packaging packaging. Then we're going to put on the syringe with our dominant hand, which is the sterile part. And then we're going to lubricate the end part without touching it, of course. And then seal it again with light touch. And then we're going to use our forceps to perform perineal flow. Forceps without yung gagamitin natin yung eye line. Discard all the patient's perineal upward, then perform perineal care. Then discard sa sport. Doon naman sa babae naman. Sa babae naman, first doon sa loob. Then discard it, discard the cotton. Then another one for the outside part, around the labia minora, in a circular motion. Then discard again. Then here we're going to, with the glove hand, we're going to spread the labia. So dyan we assess kung ilang hanggang saan ilalagay yung catheter. Then as for the male naman, we're going to assess if the patient is circumcised or not. Then we're going to position the penis of the patient in an upward motion again. Then put in the catheter 5 to 7 centimeters until we feel, or hanggang sa feel the resistance. Then saka yung syringe na-feel na doon sa balloon para may na inflate. Then dito mo naman na nagre-return ng urine. Then gently remove the catheter. And then for the female naman, catheter. And then for the female naman, use the sterile hand. And then yung dominant hand, siya lang yung mag-aano ng catheter. Mag-hold. Pero with the and then we're going to inject syringe. Into the catheter. So after that, gently remove the catheter. Discard all the equipments. Put it in a proper receptacle. Put on another gloves. And then use the catheter to perform perineal care. So this time, gagamitan natin is alcohol. Work with 1 water. Alcohol muna, then itong warm water. Around the patient's labia, and then the legs, the thighs, between the thighs, and same goes for the around the patient's penis and the thighs. Discard and put in a proper receptacle. Discard the gloves. Record the time, the amount of urine, and the reaction of the patient to the procedure. Thank you.